Tina mentioned my title. Thanks, Tina, President. That's fine. But really, I'm here today as one of 1,300 caregivers in our ACMC healthcare system. So, and I got to say, every one of us is dedicated to serving our Ashtabula County communities. Today's an exciting day and historic day for ACMC. Today, June 30th, 1904. Say that again, 1904, Ashtabula General Hospital opened its doors to begin caring for our community. To the day, June 30th, 2022, 118 years later, we are breaking ground on the hospital's largest ever construction project, a 115,000 square foot patient care tower that will be right here, right next to it. Today represents the culmination of over a decade of work, 10 years of work by our ACMC Board of Directors, who had the vision and commitment to continuously advance our mission of providing quality care to the communities we serve. So at this time, if you'll indulge me, I would like to read the names of our current board members of the board, most of which have been with our board throughout those 10 years. So I'm going to go down the list. Nancy Kister, our chairperson. These are in no order. Dr. Bibidakis, Peggy Carlo, Roger Corlett, Joji Angola. We also have Cleveland Clinic representatives on our board, and I'll read those names: Jason Hergenroder, Kelly Hancock, and Dr. Rick Parker. Craig Cernick, Dr. Taich, who will be speaking in a moment, Jim Timonier, Dave Pontius, Marlene Sartini, who chairs our quality committee, and hopefully, did I mention Reverend Vernon Palo. Hopefully I didn't miss anybody, but we have a tremendous board, again, 10 years of planning. And I do want to also include in that list, and he's here today, Bill Dingledine, who is an immediate past board member. Bill termed out after serving so many years on our board just this past March, but I do want to recognize Bill's contributions also. So we stand here today because of the work of thousands. It's not just us standing here today as caregivers, but thousands of dedicated ACMC employees who have come before us over those 118 years. They worked tirelessly and contributed within the walls of ACMC, keeping our mission alive for those 118 years. We would not be here without them today. As we go through today's proceedings, I just ask you to think about all those who have come before us to get us to where we stand today. So there's several more audiences I need to thank, and I'll do that later on. But I want to talk a little bit about the tower now. So when completed in early 2024, first quarter sometime we're looking, the new patient care tower will feature something that we don't have now. A beautiful front door lobby. It is going to be beautiful. I think we have a picture of it back there, a rendering. It's going to be a modern lobby that'll be the entrance to our hospital. It'll be welcoming, comfortable. When you go into that lobby area, you'll even be able to enjoy some food, some snacks in our snack bar, and maybe even a little shopping in our new gift shop. Again, a place of comfort. But patient care is the focus of our new tower. The tower will include 55 brand new private patient rooms, including 10 intensive care rooms. Each room will be private, their own bath, their own shower. Any of you have been in our current rooms, you know the struggles that we have and that our caregivers have delivering care. Emergency department will have 24 brand new rooms. There'll be 5 state-of-the-art operating rooms, including surgery preparation rooms and post-surgery recovery rooms. The new tower is also going to contain on the first floor a new wound healing center. It's a very busy center, deals with a lot of diabetic patients. You know how prevalent that is in our community. So having that center close, easy access will be a real advantage. We're also going to add a community education room that'll hold 90 to 100 people. We are a teaching institution. We do a lot of teaching, and to have some facilities for the general public that we can educate, and our internal audiences will be part of this project. So while our new patient care tower is being constructed to serve our community, it's also constructed in honor of our caregivers. This project will provide the most modern facilities available for our caregivers to work in. To make sure that our new building meets the needs of our caregivers, as much as possible, we've involved them in helping us design their work areas. ED is a great example. I was down there yesterday, and to see the impact that will have on the design of this project was tremendous. So as an example, we engage teams of caregivers to help determine the room layout. This means rooms in the new tower are being designed around workflow. We're not just going to build a building and say work within it. We're trying to get as much input as possible on how the building should be constructed to improve workflow. Some of those examples are higher ceilings so we can have patient lifts, a modern equipped security station at the walk-in entrance of the new ED, additional surveillance and video cameras throughout the building. We are incorporating as many safety features as possible. We're looking at magnetometers, metal detectors at the entrances, and we're in the process of even talking about more security. Our project's not just about a building. It's about continuing the high quality of healthcare for Ashtabula County far into the future. With that thought, and you'll see it all over everything, we chose the theme, Advancing Healthcare Today and Tomorrow. Even the cookies have that on there. In my understanding, they were put on by hand. It's just tremendous. So what a job to help us here today with some goodies. Anyway, it's a theme that pays tribute to our past, recognizes what we do today, and promises what we'll do tomorrow. So I'm going to close with my list of thanks. It'll be a little bit long because there are so many. I would now like to thank the many parts and recognize the many parts of our team. First of all, most of you, the Ashtabula County community. Thanks for entrusting your care to us over the years. We know you have a choice. We are honored that you choose ACMC. The ACMC Foundation Board of Directors, led by our board chair, Sandy Kanicki, thank you for your continued support. The projects funded by the foundation have helped improve the experiences of our patients and our caregivers. I'd also like to thank and mention two members of our healthcare system, Glen Bay and Home Health, critical to ACMC's success. Because of their work, we are able to, and contributions, we're able to build this building. Now to the ACMC caregivers. Thanks for all you do to care for our patients, our community, and each other. There are over 30 departments within the hospital, 30 departments, and they all contribute. They all in one way or another play a role in the care of patients. Every department depends on at least one other department. Thank you for being a team. Thank you for saving lives and for putting our patients first. Due to how busy we are, I know many of our caregivers today could not come out. They are taking care of patients in the building. They are working over in offices, taking care of bills for our patients. They continue to work, but I want to recognize those caregivers who could not be here today. The ACMC, next I'm probably going to give away our strategic plan. So it's always been the same. And I want to thank the medical staff. Again, we're all a team, we're all equal, but in this community, without a broad scope of medical staff, we don't exist. So I want to say thank you for bringing your knowledge, skill, and expertise to our community. Our success depends on you now and into the future. So I got to shake hands and want to recognize several of our elected officials. Thank you for your support. Several are here today of ACMC and your dedication to Ashtabula County. When you talk about teamwork, I'd like to recognize another important team, and many are here today, and that's our design and construction team. I'll go down the list quickly. Bostwick Design Partnership, Health Tech, which is our owner's rep, Independence Construction, Independence Excavating, you see a little bit of that out here, Karpinski Engineering, Barber Hoffman, United Panel and Glass System, Langen, and Lake Erie Electric. Thank you for your expertise and guidance. We're proud to be working with each of you. Your work will make a significant impact on healthcare and the lives of our Ashtabula County residents for decades and decades to come. So thank you for giving me so much time. It was a little bit long, but in closing, I'd like to thank everyone again for joining us.
Thank you all and good afternoon. It's an honor to speak with you today, representing the medical staff at ACMC. Our physicians are thrilled about this project. It will have a very significant positive impact on patient care at our hospital. And I want to highlight just a few of the many improvements in care that this building will help us provide. Space is one of the biggest challenges we have in our current hospital. Our patient rooms are semi-private. Each has 2 patient beds, 2 nightstands, 2 bedside trays, 2 visitor chairs, and not a lot of room left over. So there is not really space for family. The new patient care tower will have all private rooms and much more spacious rooms. And not only will that make it easier for more than one family member to be with the patient at the same time, but it'll be more comfortable for patients and their families to ask questions and have privacy. Private rooms will also make it much easier for patients to rest and sleep, and that is crucial. The building's design will give patients more exposure to natural light. Exposure to natural light, better sleep, can aid healing, reduce anxiety, depression, regulates the sleep-wake cycle, improve pain relief. The benefits are legion. When completed, the new emergency department will be larger and will have more rooms, and this should reduce wait times. It's something that anyone who's ever visited any emergency room can appreciate. The emergency department will have designated behavioral health rooms. It will have enhanced security features. All of these things are great benefits. The new tower will have a great benefit to our medical staff as well. And I want to second what Mike has been saying. And this design has been happening with input from all our caregivers and medical staff members included, and that's much appreciated. And there will be great new efficiencies in the new hospital. Larger operating rooms will allow us to fully and efficiently use the technology of today, and just as important, allow us to bring in the technology and equipment of tomorrow. Pre-operative area will accommodate more patients and family members, provide improved privacy, comfort. Post-anesthesia care unit will again feature space for family to see surgical patients following their procedures. And that is something that is very limited at our current facility. Now, we've had tremendous success in recruiting a medical staff here at ACMC. Recruiting, of course, is a competition, and newer facilities can often influence where a physician decides to practice. So this project will serve as a recruitment tool, helping us attract more physicians to Ashtabula County and helping us to care for more patients. Finally, I would also like to express my gratitude on behalf of myself and medical staff, and first and foremost to members of this community who have trusted us to take care of them at their time of need. None of us would be here today without that trust. I'm grateful to all the caregivers at ACMC for choosing to work at our hospital. And of course, we're very grateful to our administrative team, our board of directors, our partners at Legal Clinic for being great stewards of our organization. So I'm proud of our hospital for taking on this project. We're excited about it. We're excited what it means for our patients and of course our medical staff. Thank you very much.
I'd like to share a little bit of our history. As many of you know, our existence stems from the community's reaction to the terrible tragedy of the Great Train disaster. A small emergency hospital was used to care for injured railroad workers in the latter part of the 19th century. That was the beginning. In 1892, the Ladies' Hospital League was organized and served as the impetus to the organization of Ashtabula General Hospital, which opened in 1904, as Mike mentioned. Also, from that beginning, and in this very neighborhood, a few hundred yards from the bridge collapse, Ashtabula's first hospital was built. And so, for 118 years, the health and the well-being of Ashtabula County and the success of ACMC have been intertwined. Today, the ACMC healthcare system is the largest employer in the county, with 1,300 caregivers. Each year, over $1 million is infused into the economy through the salaries and benefits of those caregivers. The healthcare system also contributes in excess of $1,150,000 each year in combined income tax revenue for Ashtabula City, Conneaut City, Geneva City, Geneva Schools, and the village of Jefferson. From that information alone, it's really clear that the success of ACMC has a significant influence in the overall health of the county's economy, actually, and we don't take that responsibility lightly. We're fortunate to be working with design and construction partners who are honoring our commitment to through the use of local vendors whenever possible, including dividing various parts of the project into a size and scope that our local businesses can take on. As of today, almost $6 million has been completed by or awarded to local vendors. As the project progresses, there will be even more opportunities for those businesses to become involved. This new patient care tower demonstrates ACMC's absolute commitment to quality health care for many decades to come. It's also an important investment in Ashtabula County's future, with impact way beyond the walls of the hospital itself. I'd like to thank all of you for attending today. It is really gratifying to see all of you here.